Hello, everybody. In the next 20 minutes, I'm hoping to take us through the steps on how to conduct research and then how to publish your findings as a paper in a journal. The first part of the project is to identify what is the problem that needs to be answered. We then have to define some specific questions which we wish to answer with the research. And then, of course, we need to know what has been undertaken before. So we need to perform a literature review. Fortunately, it's easy to do this with something like PubMed, where one can put in the topic and see what other colleagues have published in the area. After we have this knowledge, we can clearly define what are the questions that we're going to ask. Having done that, we can then design the research questions and work out how we're going to carry these out to answer the relevant questions. It is also very important right at the start to get some statistical advice and to work out how many patients or subjects have to be undertaken in the research to achieve significant results. And of course, in the current climate in 2022, it is important to get permission from the appropriate ethics committee, because research can only be published once it's been approved by an ethics committee. Finally, if you're carrying out a randomised trial, it is also necessary to register the trial within the register of randomised trials so that it's got a record. And again, this is a prerequisite prior to publication. To work out the appropriate number of patients, it's very easy. Either we can consult a statistician, or one can use a program such as this one that's available in Australia, the Bureau of Statistics, where one can enter a number of the variables, such as the confidence limits, the population size, and then that'll calculate for us a sample size if you're not using a statistician. But of course, it's always best to have a statistical college working with one to make sure that we get everything right, because there's nothing worse than concluding research and find out that the statistics weren't done properly and the whole episode is worthless. Having conducted the research, and we've clearly defined the questions, we've done the study subjects, and we defined the methodology, and we actually have the data, we've analysed it. We then have to sit down and write the paper so it's of such quality that it can be accepted for publication without too many alterations needed. Nothing worse than writing a paper and having come back requesting major revisions and entailing a whole lot of extra work. So having completed the research and having got the data analysed, we have to write the paper. And at this stage, I'd like to give credit to my friend, Professor Hans Evers from Holland, who was a past editor-in-chief of Human Reproduction, who to me is the best expert on how to write a paper. And I'm grateful for him letting me use the following slides, which I got from him about 15 years ago when I went to a seminar which he gave on how to write a paper. And I think it makes it very, very straightforward. There are three types of readers of scientific journals. There are the grazers, who sort of graze through the papers, look at the titles, maybe look at some of the abstracts. There are hunters who are interested in one particular topic, and they want to read everything about one particular topic. And there's a small percentage who read every journal cover to cover, and they gorge themselves on the medical literature. So how shall we cater for all these readers? Well, the first two questions we ask when we read a paper is, or when we write a paper is, what is new from my research? And what do I want to say to get the message across? And Hans Ever's formula for this is to have 5 sections with a total of 18 paragraphs. And that's all you need to write a paper of a quality that'll be accepted by refereed journals. The first part is introduction. Then there's the materials and methods with 5 paragraphs. The results, very important, is discussion and the conclusions. And I'll take us through either of these next. So let's go to the introduction. There are 3 sections to the introduction. One should always start off in the first sentence, repeating some of the words from the title to emphasize this. The second sentence should say, why did we do the study? And thirdly, we should explain the motivation of writing the paper and sending the message across. We'll have more on this on the next slide. So the motivation might be, we might have a purpose of a paper, which is to prevent evidence-based approach to a certain clinical problem. Or the scope of the paper might be to discuss the 5 causes of a certain condition. The paper might be a viewpoint, for example, calling patients insulting, and we need to explain why we disagree with that. Or it can be a quotation, that's something that's been often said that we wish to dispute. Or the question might be, what is the best way to do something? Or it could be an argument about the best way to diagnose syndrome, or the action, it's time to reconsider IVF adjuncts. Sometimes it's a case report where we've seen an interesting patient and we want to bring it to the attention of our colleagues, or we might be quoting a statistic saying 1 in 6 couples have subfertility. So they're all the motivations that we would want to put in the introduction. The next section is the materials and method section, and that is divided into 5 different parts. The first one is to describe the study subjects and the study design, the inclusion and exclusion criteria, the patient demographics, and again to confirm that we've got consent from the ethics committee. The 5th paragraph is to discuss the protocol that we used, if it's a trial where we've had interventions, the medications and equipment we might have used. The 6th point is to talk about the criteria and definitions of what we actually looked at. And finally, we go through whether the data collection was retrospective, prospective, how the subjects were selected, whether there was randomization, the data quality, and the validation, whether there's any blinding, and the variability observations. And the final part of material methods should be describe the statistical methods and tests which are used. Finally, and then we get next to our results. And again, that's divided into 4 sections. The results of the subjects, we've had the demographics, the results, and we present the figures and the facts without an editorial, the quantitative information, the tables and figures, and what we've done as tables and figures should not be repeated in the text. And finally, we correlate the findings with what we expected, the gold standard, and where they're statistically significant. Having completed the results, we then get to the juicy part, which is discussion, where we summarize the principal findings and make some conclusions. And although we compare it to the existing literature, we must not do a repeated literature review at this stage. Finally, we have to state what are the clinical implications of our study, the new insights, and of course, we should be self-critical and have our limitations. Then the final conclusion should be the so what question. What were the principal findings? What are its implications? What have we achieved? And what are the next steps? So this is a summary of the 18 paragraphs that we need to write a paper. Just to finish off, let me tell you what not to do. The worst thing is to do not to read the instructions to authors. And for example, exceed the maximum lengths of the paper by at least 1,000 words and 2 tables. It's important not to use ponderous words and not to make everything seem ambiguous. It's best to have things concise and easy to follow, not to confuse people, thinking that if readers can't understand it, then they'll think it's really clever. As far as the reference are concerned, only relevant publications should be mentioned. It's not a way of getting all your previous work referenced in a paper. It should only be relevant to current work, and don't confuse what you put there. Do not include results in the material and method section, and don't put discussion in the results. And if you do all this, your paper will be ready for submission to a medical journal. And of course, which journal? Your first journal of choice should be our journal at Aspire, Fertility and Reproduction. Thank you.